Hi, I'm Carol, Director of Clinical Services for Heckman Healthcare. I am also a respiratory therapist. Your medical provider has prescribed PAP therapy to treat your diagnosed sleep apnea. The purpose of this presentation is to instruct you on the setup and function of the Resmed Airsense PAP system. In addition to this presentation, one of the respiratory therapists from Heckman Healthcare will contact you to explain the findings of your sleep testing and answer any questions you have about sleep apnea, PAP therapy, and related topics that you are concerned about. Your Resmed Airsense system, which is a PAP system with an integrated heated humidifier, has been programmed by our respiratory therapist according to the prescription received from your medical provider. This system will monitor your usage, which in many cases will determine continuation of coverage by your insurance provider. Our respiratory therapist will explain this in specific detail based on your insurance company's requirements. The system also monitors how your mask fits and even the correction of your sleep apnea by apnea-hypopnea index, or AHI. All this data will transmit to our office via modem as long as your PAP is plugged in. This patient-friendly system even allows us to adjust settings via modem, as ordered by your medical provider. To set up your system, first determine where in your bedroom you want to place the PAP. It is advised to place your PAP at sleeping level or lower, and most people clear a spot on their bedside table. Note that you must have access to an electrical outlet. Once you have located the best spot, you're ready to set up your PAP. The power supply for this system has about 10 foot of cord between the two pieces, and it plugs into the wall with a two-prong connection. The other end of the power supply has a post that must be placed securely into the port located on the back of the PAP system. Once plugged in, please be sure that your system has power. If not, please check your connections. Note the air inlet, which is located on the side of the unit opposite the humidifier. You will see an area with small holes. This is the door to the air inlet, which holds the PAP filter. Please allow at least 1 inch of space between this side of the PAP and any cabinets or other obstructions. It is important to ensure the PAP can freely draw in air to pressurize without being overworked. Upon careful inspection, you should see a notch located on one side of the air inlet, which is used to open the air inlet door. Please place your thumbnail in the notch to open the door. When open, you will see the disposable filter. Please check the filter at least weekly. Tap the filter off to remove dust, and when discolored or very dirty, please replace the filter. Note the Resmed system does not have a rinseable filter. After checking the filter or replacing as required, simply place the filter in the rectangular shaped portion in the air inlet door. There is no inside or outside to the filter, it just needs to fit the space. Close the air inlet door. Next, we will discuss the PAP tubing. Most PAP tubing will work with the Airsense PAP system, but we do recommend the climate line tubing specifically designed for the Airsense system. It is a 15 millimeter inner diameter tubing that can actually prevent water condensation from developing in the tubing. Please locate the tubing and remove it from the package. Note the 3 brass strips on a pad on one port of the tubing. Now look at the tubing connection port located at the back of the PAP. Find the box shape located at the connection port. The pad with the brass strips must engage into that box, and the rest of the tubing slides onto the large round tubing connect. Once properly engaged, the tubing can be rotated. This feature allows the user to place the tubing in a position that reduces stress on the PAP tubing and maximizes the user's comfort. PAP systems are basically air splints, a flow of air to reduce airway restrictions and blockages that cause sleep apnea. Many patients find that the constant flow of air causes tissue dryness to their airway. To resolve this issue, your Airsense system has a built-in heated humidifier. The system is currently set to adjust both the humidity and the tubing warmth based on your environment to provide a comfortable level of moisture while eliminating water condensation. If you do not find the auto setting for climate control is to your liking, one of our respiratory therapists will assist you in adjusting the settings. Please locate the humidifier reservoir and remove it from the packaging. This reservoir should be placed in the humidifier portion of the PAP which is located on the side of the system opposite the air inlet. When the reservoir is engaged in the PAP system, it can be removed using the following process. Stabilize the PAP system with one hand. With the other hand, gently squeeze the top and the bottom of the reservoir and remove it by pulling it out of the humidifier port. Set the humidifier aside and look into the humidifier report. You should inspect this weekly and contact Heckman Healthcare if you find any damage or mildew. The stainless steel plate on the bottom of the humidifier port is basically a hot plate which will warm the distilled water placed in the reservoir to create the humidity. To open the reservoir, locate the gray arrow. Lift up under the ridge to open the reservoir. Find the fill gauge located in the lower corner of the reservoir. The system manufacturer advises use of distilled water. It is important to not overfill the reservoir and to empty the unused water after each use. Please keep the reservoir level as you place it in the side of the humidifier port, stopping when it is flush against the side. Never move the PAP with water in the system. Always remove the reservoir before moving the system. On to the mask. For the first few sessions, we suggest you practice placing and removing your mask device in front of a mirror to become more comfortable with the placement and fitting. Heckman Healthcare's respiratory therapist will give you instructions, including video links for the specific mask device. If you have set up your PAP, connected the climate line tubing to the system, and inserted the safely filled humidity reservoir into the humidifier port, you're ready for bed. Apply your mask device per instructions. If you're wearing a full face mask, which allows flow via nose and mouth, gently push and release the on-off button, which is located on the top of the PAP system in the center of the device. If you're wearing a nasal pillow, cradle, or nasal mask, simply place the mask correctly and start to breathe in and out through your nose. The PAP should cycle on within the first few breaths. Note to nasal mask breathers, you cannot breathe through your mouth. You must breathe in and out through your nose with your mouth closed with a nasal device. That being said, make yourself comfortable in your bed. You will notice that for the first few seconds of therapy, the screen on your PAP is visible. You'll see a circle in the center which shows the current flow pressure being delivered. After a few seconds, the screen dims and the light on the on-off button dims too. This is to reduce disruption to your sleep. If you need to visualize the screen, simply press and release the round knob to the right of the screen. This will brighten the screen for a few seconds. When you wake up, simply remove the mask device. With a full face mask, you will push the on-off button to stop the flow. With most nasal devices, the flow will stop about 10 seconds after you remove the mask device. If not, you can also stop the flow by pressing and releasing the on-off button. Your system will display the last session's data when you stop the therapy. You will notice a blue snowflake flashing in the top right corner of the screen. This indicates that the system is in cool down and is blowing a gentle flow of air through the system for up to 30 minutes to help cool down the heating element and air out the tubing. Post-session sleep report is basically your PAP report card where you can see how much time the PAP system was in use in your last session, as well as the average number of apneas and hypopneas in your session, events per hour. Next, we want to see a happy face by mask seal because this means the mask fit in my last session was good. A red, frowning face means my mask fit needs work. The respiratory therapist at Heckman Healthcare will be happy to assist you in resolving a poor mask fit if required. Remember that a poorly fitting mask can reduce the effectiveness of the therapy. Humidifier function is also displayed on the sleep report screen. You should see a happy face here too. If you see a red frowning face, please contact Heckman Healthcare and ask to speak with a respiratory therapist. We offer access to additional data in the sleep report screen. By rotating the knob to the right of the screen in a clockwise direction, you can scroll down More Info, which shows your usage, mask fit, and pressure data over the most recent 30 days. You can even have data from your PAP sent to your cell phone, iPad, or computer via Resmed's MyAir app, which is free to most users. This app will also link you to helpful tips regarding use and care of the system and mask devices and feedback on your therapy. Remember that the respiratory therapists at Heckman Healthcare will be following your data in the initial stages and welcome your questions and insights regarding your PAP therapy. We are happy to work with you to customize your therapy and will work with you and your medical provider to ensure the most beneficial PAP therapy experience. Our respiratory team at Heckman Healthcare believes it's important for our patients to understand their diagnosis, what sleep apnea is, and what the appropriately set PAP system can do to improve their health. Additionally, we know that it is so important for the patient to understand how to safely use and care for the system and supplies. With this in mind, we'll now go over the care of the PAP supplies. Regarding the mask device, please wipe the part of the mask that touches your face, the seal or cushion, daily with a damp cloth. Please do not use paper towels, baby wipes, makeup wipes, antibacterial wipes, or household cleaning wipes. At least weekly, please remove the reservoir from your PAP system, as well as your climate line tubing, and place them in your kitchen sink or an appropriately sized basin. Add your mask device and headgear. Note, memory foam cushions cannot be submerged or cleaned with any soap, vinegar, etc. They can only be wiped off daily with a damp cloth. Fill your sink or basin to cover the items. Add a pea-size amount of dishwashing liquid or baby shampoo and a cup of white vinegar. Wash the items and inspect all components for defects. Rinse thoroughly with clear tap water and allow all components to air dry. Most of the components can be placed on a clean towel on your countertop to dry, but please hang your climate line tubing in a place where it can drip dry for 8 to 10 hours. At least weekly, we also advise that you leave the water reservoir out of the system for several hours and that you wipe out the humidifier side of the system and the exterior of the system with a damp cloth. Whew! This is a lot of information. Your Airsense system has a set of manuals to assist you in setup, use, and care. And the respiratory therapist at Heckman Healthcare will be monitoring your usage, fit, and correction as you adjust to this therapy. We will follow up with phone calls and welcome your calls to our respiratory department at 217-877-0346. Thank you for allowing us to be a part of your healthcare team.